All right, Rick, I'll hand things over to you.
Hi, I'm Rick Olson, and I'm the Vice President of the Washington State Alliance of Retired Americans, and I represent the retirees here in Eastern Washington. I also represent the Steelworker Organization of Active Retirees here in Eastern Washington also. I just want to say how much of an honor and a pleasure it is to be a part of this group and be a part of the campaign that is pushing to see Patty Murray return to her position as senator representing the state of Washington. We're talking about prescription medicine here today, and I just want to maybe relay a story that I have that's personal to me. My parents are elderly. When I was younger, they never took pills. They were healthy as a horse, and as they got older, they started to rely on more prescription medicine. And my dad is 95, my mom is 93, and my dad's got a pill box that's full of pills, and my mom takes a certain amount of medications also. I know that my mom's diabetic, and so this insulin, the measure that Patty Murray got in relation to the insulin is very, very important to her. They're on a fixed income. They're comfortable, but they are on a fixed income, and so every penny counts to them. And so when this got passed, it was a real plus for them, and they're really appreciative of the work that Patty Murray has done. And in relation to all the retirees here that I represent, they're all, excited. We had a meeting on Tuesday or yesterday and I relayed the information that I'd gotten with the group with Steelworkers Organization of Active Retirees, and they were all excited and they were all very, very appreciative. So let me pass that on to you. That's kind of all I have. I'd like to turn this over to Leslie Sather.
Thanks, Rick. Good afternoon, and thank you for having me here today. My name is Vivian Sather. I use she, her pronouns, and I was born and raised in Spokane, Washington, where I continue to live and work as a health insurance navigator. So I did not receive health coverage until I was about 18 years old when the Affordable Care Act was passed and Medicaid eligibility was expanded. So I know firsthand how important it is to have access to affordable health coverage and how important it is to one's physical and mental well-being. Something to this day disproportionately impacts communities of color and the LGBTQIA+ community. I'm a huge proponent of the ACA because as an insurance navigator, I help individuals and family every day get connected to health coverage on Washington Health Plan Finder. I see the positive impact it makes in people's lives and for our community as a whole. Our network in Eastern Washington has helped enroll well over 150,000 residents in health insurance since the inception of the ACA, lowering our county's uninsured rate to 4.7% in mid-2021. And with the COVID-19 pandemic, we saw folks who lost their jobs and in turn lost their health coverage. With the American Rescue Plan Act, or ARPA, this made it possible for people to enroll in health coverage, with more tax credits being available to lower their monthly premiums. I assisted someone about a year ago who lost their job in Pend Oreille County. They were a single parent juggling childcare and finding income to support their family. They were able to find part-time work and enroll in a health plan on Washington Health Plan Finder for about $40 a month with the savings from ARPA. With the help of Senator Murray in championing the extension of these benefits with the Inflation Reduction Act, the people I help every day will be able to continue accessing affordable health coverage. They won't have to worry about putting off a doctor's appointment or missing important moments in their lives. These benefits directly support working families and people who don't have access to health coverage traditionally through their employer. People's lives are at stake when access to healthcare isn't available. This affects communities disproportionately and will further exacerbate disparities across different impacted groups. I thank Senator Murray for supporting legislation that puts individuals and families first, and we need to continue supporting the leadership that puts health equity and access to affordable care at the forefront. Thank you. I will now turn it over to Leslie Dock, who is the chair of Protect Our Care.
Thank you, and thank you for all that you do every day to get people insured. It makes a big difference. My name is Leslie Dock, and I'm the chair of Protect Our Care, which is a Washington, D.C.-based healthcare advocacy group with staff around the U.S. And before I founded Protect Our Care in 2016 to protect the Affordable Care Act, I was the senior counselor to the Secretary of HHS in Washington, D.C. The Inflation Reduction Act is landmark and historic legislation. It will dramatically lower the cost of prescription drugs, reduce healthcare insurance premiums for millions, saving families thousands of dollars a year, keeping them healthy, and addressing systemic inequities in access to care. It's particularly needed at a time that even though inflation is showing signs of slowing down, Americans are also grappling with rising costs and tight family budgets. It's no surprise that this legislation is incredibly popular with the American people, no matter what party they belong to or where they live. And it's a victory over the special interests, particularly over the large pharmaceutical companies that spent close to $200 million trying to defeat this bill. We all know how being sick takes over our lives. Imagine being sick when you can't afford the care you need, can't see the doctor you know you need to see, what that does to your life, your family, and obviously to your health. Unfortunately, that's the reality for millions of Americans, and this bill will help end big parts of that. And it's important to know that the help is coming soon. Because of the IRA, in 2023, 13 million Americans will pay less for their health insurance costs, including almost 170,000 Washingtonians. Beginning in 2023, just a few months from now, the monthly cost of insulin will be capped at $35 a month. And Senator Murray and others tried to extend those savings to people below Medicare age and on private insurance, but Republicans refused. Beginning in 2023, for seniors on Medicare, vaccines will be free, including highly expensive vaccines like the shingles vaccine. Beginning in 2023, seniors will begin to be protected from egregious annual price increases on drugs they're already taking simply because the companies can get away with it. The bill guarantees that seniors no longer will have to pay more than $2,000 a year in out-of-pocket costs for their drugs. Today, many spend tens of thousands of dollars a year on drugs they need to stay alive. And finally, Medicare will be given the power to negotiate for lower drug prices, so Americans no longer have to pay 3 to 4 times more for the same drugs in the United States than people do in other countries. As the previous speakers have said, this bill will make a real difference in the lives of real people. I'm a Medicare beneficiary, and I know exactly what that means. People who work hard every day but simply can't afford the drugs they need to stay alive. People who work hard every day but can't afford to pay for the health insurance and die before they should because they haven't been diagnosed in time. You would think this would be easy. You would think this would be as close to motherhood and apple pie and good common sense as any legislation you can imagine. But the reality is that every single Republican in the US Senate voted against this bill. They voted for higher health insurance premiums for 170,000 Washingtonians. They voted for higher insulin costs. They voted for higher prescription drug costs. And we know that if Republicans take control of the Senate, that they will attempt to repeal this bill, starting on day one. Why do we know that? Because they've said so. Because the head of the Republican Senate Campaign Committee has said so. Because Kevin McCarthy has said so. We know this is their agenda. And then they'll be gunning for the Affordable Care Act as well. That's why senators like Patty Murray are so important. I've worked in Washington, D.C. in politics for a long time. And we succeed in doing good things when there are champions and leaders like Senator Murray leading the good fight. People who have the guts to fight, people who have the judgment to do the right thing, and people who care about their everyday constituents instead of their special interests. Senator Murray, I've seen firsthand, embodies all of those skills and all of that dedication with a genuine kindness and caring for her constituents. I've seen her employ all those skills to be sure that government works for the people, whether that government's run by Democrats or by Republicans. She's a leader we can count on, and a leader who truly leads. She's a leader we truly need. And trust me, there are very few like her. Senator, it's a pleasure and an honor to turn the microphone over to you.
Well, thank you so much, Leslie. I really appreciate that. Rick and Vivian, thank you for sharing your personal stories. It really means a lot to me. And I so appreciate everybody being here today to talk about something that is so important to me, and that is lowering the cost of prescription drugs and healthcare, and how we can build on that progress we've made this November at the ballot box. You know, for years, I've heard from countless patients across Washington State who cannot afford their prescription drugs. And every year in Congress, I fight for policies to hold giant pharmaceutical companies accountable and lower costs for all of us. This year, when we passed the Inflation Reduction Act, patients won. We beat Big Pharma and made enormous progress, especially for our seniors. That's why the Inflation Reduction Act is such a big deal. It finally gives Medicare the power to negotiate lower prescription drug prices for our seniors. We're bringing drug companies to the bargaining table, and patients everywhere are going to benefit. We're going to cap seniors' annual drug costs at $2,000 a year. And we're going to cap insulin for Medicare at $35 a month, and protect Medicare patients from drug companies that are jacking up prices just to make a quick buck. This is really huge for the more than 1.4 million Medicare recipients in Washington State who will save a whole lot on their prescription drugs, because no one should have to empty their savings account just so they can fill a prescription. Now, I made sure we also moved the ball forward on strengthening and expanding the Affordable Care Act when we passed this bill as well. The Inflation Reduction Act expands the healthcare tax credits from the American Rescue Plan that helped millions of people save thousands of dollars on their healthcare this year that Vivian just talked about. These tax credits helped lead to record enrollment in the healthcare exchanges, bringing our nation's uninsured rate to an all-time low. In Washington, thanks to the tax credit, more than 60,000 new people signed up for healthcare coverage last year. 2 in 5 found coverage for less than $100 a month. And 40,000 people in Washington State were eligible for coverage that costs less than $10 a month. This isn't just about saving people money. This is going to save lives. Right now, we know that patients are rationing their prescriptions or afraid to see their doctor, not because they're scared of a diagnosis, but because they're scared of the price tag. The Inflation Reduction Act is the biggest step Congress has ever taken to lower prescription drugs and healthcare costs, and I'm very proud to have worked to get it across the finish line. But here's the deal. Republicans have no healthcare plan. They have no plans to lower everyday costs for people in Washington State. The last time Republicans controlled Congress, their plan was to repeal the Affordable Care Act and deliver massive tax giveaways for billionaires and giant corporations. And they managed to get half of that accomplished. We cannot give them a chance to finish the job and take us all backwards. I am determined to build on that progress, as are all of my Democratic colleagues. I want to cap the cost of insulin for everyone, not just on our Medicare patients. I want to help deliver a strong federal public option to help bring down healthcare costs and to expand coverage. And that will not happen if Republicans control the Senate. Here is the fundamental difference. Democrats understand that life-saving medicine doesn't do any good if people can't afford it. And we're doing something to make sure everyone can get the care they need. Today, Republicans are more interested in siding with big pharma friends. But I'll tell you what, we can build on the progress we just made on the Inflation Reduction Act. I know we can, but we have to vote and we have to win in November. Thank you all for being a part of this, and I think we have some time for questions.
Alrighty, thank you so much, everyone. I'm going to open it up for questions. Please use the raise hand function and say your name and outlet when I call on you if there are any questions. Alrighty, if anyone has a question, feel free to go ahead and unmute yourself. Give folks another minute here. Alrighty. Well, if there's no further questions, we can go ahead and end the call now. Thank you so much to our speakers for taking the time.
Yeah, and Rick and Vivian, lessons, thank you so much. Thanks for all your hard work out with our communities. I really appreciate it. Take care. Thank you.
Thank you.